Good day, everyone. Eco Alt blog is live at the National Institute of Medical Research, JABA, for the visit of Japan International Cooperation Agency, JICA, to discuss bilateral cooperation in area of medical research. The Nigeria Institute of Medical Research, under the leadership of Professor John Oladapo Bafunwa, has been up and running in terms of fostering positive trend of development in networking with organizations and governmental bodies beyond the shores of Nigeria to attract positive development in medical research across the country. JICA aims to strengthen health system in developing countries through a focus on treatment, precautions and prevention. This meeting with the Director General aims to look at the areas of future cooperation and assistance. Stay tuned as Eco Alt blog brings to you live coverage of this event as it unfolds. I am Taiwo Idowu reporting for Eco Alt blog. The Nigerian Institute of Medical Research, NIMR, has entered into a strategic partnership with the Japan International Cooperation Agency, JICA, to boost medical research capabilities in Nigeria. This collaboration, led by the Institute Director General, Professor John Obafunwa, aims to strengthen international cooperation, knowledge exchange and research capacity building. A team of 9 medical experts from JICA, led by Mr. Kenji, on Monday visited NIMR headquarters in Yaba, Lagos, to explore potential areas of collaboration. Other senior staff of the institute, including Dr. Nelson, Dr. Rosemary Odu, and Dr. Bamidele Iwatokun, were present for the discussions, which focused on critical medical fields such as vita, cultivation, pathogens, and public health research. During the visit, Professor Obafunwa reaffirmed NIMR's commitment to advancing medical research, sharing research outcomes, and fostering an environment conducive to health research and training.
If once it's positive, we don't touch it. I'd mentioned at that time that it would have been nice if we were able to carry out autopsies on all these cases. The same thing when we had the problem of Ebola. Yeah. When you do the autopsy and you do the tissue diagnosis, you try to reconstruct the pathophysiology, and that will guide you with respect to the management of the case. And it's perhaps along those lines that I would want to suggest that JICA should focus on NIMR. Yeah.
The JICA delegation expressed great interest in the ongoing projects in the institute, including HIV research and pathological studies.
So this is the way to the TV. This way.
Oh, okay. So inside. Then we have our BSF3 here.
Yes.
So
Go in here.
And then the AFMLS will be discussed by November, end of November, because so that they can look at the HVAC and also change the what is it called? The computer.
the HVAC,
the software. Yes, actually, yes, it needs updating, so they will be here with us before they enter the general system. So we do the normal decontamination here before it goes to the
all of maintenance. Talk about your HVAC and stuff.
Yes,
What about our medical engineers? What do they do for?
So what they do literally is just some form of preventive maintenance. But when a HVAC comes, we usually work with them.
They are coming to.
So now it's rainy season, so we don't have a lot of.
But we still have to move. The throughput, the number of samples, inform them, then they view the reagent for you. It can adapt to any other organisms. Okay. Presently, we use it for hepatitis B, hepatitis C, hepatitis HIV, human papillomavirus, and even COVID was done on this end.
Currently, you have that. What kind of the kit do you use?
The roach kit.
All right, let's see this way the sequencing. So to spread out things and be able to use the same sample on all of them, African samples, to make sure that they are actually picking African samples of HPV, HCV, and all of that.
So that's what we mentioned also that we do that the serology at this, we are trying to build on immunology so that we can come up with that. So we intend to start the sample processing here. Then we'll now move to, we are using this place as the clean lab where we store our pathogens that's been isolated, and then we're using this place as just reagent and storing them.
And here we have space to keep adding sequencing machines. All the level of sequencing machines, Sanga, NGS, so that we have an open kind of lab facility. And this facility was actually built so that in the next 5 to 10 years, we can keep adding facilities and we can keep growing. Alright. So it's actually built to be a core facility. All of these buildings will be Wi-Fi. So on all the floors, we have space like this to expand over into this. So the plan is, when people are bringing in samples for Wi-Fi, this is where they process it. When people are coming to take a sample from Wi-Fi, that's the way they do it. And the expression. So we have our kits for quality assessment of started RNA, double-stranded DNA protein. We have our thermocycler, which can run gradients when we want to optimize PCR. So we have all programs there. And also for doing cycle sequencing, for gene sequencing. We are going to show that. So for this facility, I told you we can that. So this is our PCR room section where we prepare our master mix. And it's that unidirectional flow, then you come out. So when you come out and wash your hand there. So if you want to use that, if you want, go ahead. The water is flowing, everything is running. Yeah.
Right now, this is like the general area where we do, I think, where's the lab manager? Okay, so this is the general area where we do cutting of DNA and cutting of the parts of the mosquitoes, and we do a bit of the extraction. So here now, in this section, the microscope, these are my other colleagues, sorry. Sorry. So this is the section, yeah, and that's the lab manager, Dr. Tolu. This is the section where we do our microscopy. This is the section where we do our microscopy, and we identify the mosquitoes through morphological means under the microscope. And so also here we do a lot of inversion polymorphism. We're doing that there are 2 papers that have been published on that for Nigeria right now. We're on the 3rd and the 4th right now. We've written 2 manuscripts. So here, maybe lab manager also comes. Here we do. Here we have our workstation where we do all the other work when it comes to extraction and preparation for molecular analysis. And from there, you come here to this section. This section where we run PCR.
And development offices here, as well as the NIMR Foundation there, rather than the NIMR Research Foundation that are here. So we have just listed offices on this floor. And then we have these offices, and then there's an unemployed equipment that are yet to be installed for cancer research.
It's in this building that I'm hoping to have a student who can set up
These two
tissue
by the
pathology
next
and
side.
for the purpose of cancer.
So we can expand the cancer research. We are doing less at the moment because then some of the things are not available yet. This is a close optometer. Yeah. Eat.
head up to the conference room.
Yes. Yeah, because Smith supported this part, so we're glad then.
After touring the Institute's state-of-the-art facilities, which included the Department of Public Health, Biobank Laboratory, and Cancer Research Center, the JICA representatives praised NIMR for its advanced research infrastructure and equipment. I bet it has been an awesome experience as we look forward to the positive impact this alliance between Nigerian Institute of Medical Records and Japan Institute of Cooperation Agency, SUNEST. Thank you for staying tuned. Don't forget to follow us on all our social media platforms at EcoAltBlog. I am Taiwo Idowu, reporting for EcoAltBlog.
The JICA, that's the Japan International Cooperation Agency, there's no doubt that even before now, they have continued to be a source of joy to NIMR. What do I mean by a source of joy? They have been involved with NIMR for quite some time, particularly in the area of personnel development, human development, helping with training. We've had a number of our staff in NIMR travel to Japan under the JICA program to train, improve their skill. And in fact, right now, we have somebody who is there doing a PhD under the JICA program. This year alone, we've been asked to nominate 2 people for some training in Japan. About a week ago, one of our staff based in Maiduguri just left for Japan. So in terms of human capacity development, JICA has been a very good friend of NIMR. Coming in today was largely aimed at trying to see what we've been doing, look at our facilities, get to know our capabilities and what we can improve upon. And as you can see, they've been quite impressed going around the facility, talking to some of our researchers. In fact, privately, they expressed the fact that we have the best facility within the sub-region, as well as when NIMR is compared with East and Central Africa. Coming in, and with this experience, I have no doubt in my mind that it will help to improve on the cooperation that we've had in terms of developing our facilities. We seize the opportunity to not just to showcase what we have, but to also touch on areas where we can do better.
So at this moment, we can invite the staffs from NIMR to training course in Japan or some other courses for the capacity development. And for the entire Nigeria, we are supporting the health sector, especially for the infectious disease control. We are going to make a new laboratory here in Lagos CPHL and the NRL in Abuja. Yes. Yes, we found that the NIMR is a very excellent institute for the medical research with very good facility, good equipment, and most importantly, many good staffs. Yes, so I think this NIMR will be the leading institute of the Nigerian medical research, and maybe in some case we'd like to ask you to be a mentor or trainer for other institute. Yes.
Yeah. Today I saw this institute's facilities, the very huge and very good facilities. I'm very surprised.
Yeah, so today I looked at the facility and institute of this NIMR. So this is a great institute and great well-established institute. So I think that in Nigeria, a lot of the infectious diseases occur, including the yellow fever and Lassa fever. So for these infectious disease controls, a lot of the research are needed, and I think that this research work were done in the near future with JICA and the Nigerian people.